Hi there, welcome to Demi RX Care channel. My name is Abidemi Adamson, and today we're going to be talking about Plan B. So make sure before I go further, make sure you hit your like and subscribe buttons just so you can get more alerts when we post our educating videos and just so you can enjoy them and also educate yourself on how to live better and also how to live a healthier lifestyle as well. So today we're going to be talking about Plan B. So this is one of the most effective methods of contraception after sex. So what is Plan B? So Plan B is a one pill medication that you can use that contains a high amount of progesterone in it. So it contains a high level of progesterone, and it has to be taken within 72 hours after unprotected sex. So you want to make sure you take this as soon as possible. The earlier you take it, the more chances that it's going to help prevent fertilization after sex. So how does it work? So it works by delaying and preventing your ovulation, and it also works by thickening your cervical mucus in order to prevent the sperm from actually permeating and fertilizing the egg, which is what we need it to do. So side effect of Plan B. So side effect of Plan B include nausea and vomiting. It include fatigue, headache, dizziness. It can cause lower abdominal pain as well as breast tenderness. So it is recommended that if you vomit or, throw up within 2 hours of taking this medication, you should repeat the dose. So if it's within the 2 hours and you have a deep feeling that you have, vomited the medication, when you vomited within that 2 hour period, you probably want to make sure you take a second dose. Although it is an expensive medication, but it is recommended. So also when you're, after taking this medication, it is not recommended that you drive because like I said, it can make you a bit dizzy. So and in some patients, it might not cause the dizziness. So side effect is a two-way street. It's either you have it or you don't have it. So it might cause dizziness, it might not. You just want to make sure that you're taking caution just so if it does happen, that, you're in a safe place and you're not doing something that requires you to be mentally alert. Okay, and another severe side effect of Plan B is heavier menstrual bleed. So within the first month or so after you take the Plan B, it can cause a heavy menstrual bleed. So you want to make sure you're getting, if you are a type of person that use tampons, you want to make sure that you're getting the one for heavier bleeding. Or if you're the type of person that use pads, make sure, you're getting one that, help with heavier bleeding as well. It can also alter the next expected menstruation. So it might be your menstrual period might kind of go all out of whack, and it can delay it for about a week or so from your regular menstrual cycle date. So making sure you're aware of that. If you don't see your period on time, make sure you're not alert, and too worried, because it is a common side effect that can occur after taking a Plan B. Also, one thing you should know is that if an implantation, which is, if the sperm has fertilized the egg, if the fertilization have occurred, then the Plan B is not going to be as effective because it is not an abortion pill. It is only to help prevent in the meantime before the sperm is able to fertilize the egg, which is your ovum in our ovaries. So make sure that you're taking it as soon as possible, after the sexual event. And also something that you should know is that it might be less effective in patients that are over 165 pounds. So if you are over 165 pounds, it might not work as much. And there's a high risk that, the medication might not work. So you probably want to reach out to your doctor to see, if there's another means they can use in order to prevent, fertilization. Also, one thing you should also be aware of is that most times if the patient is younger than 17 years old, it might only be available as a prescription. So you might not be able to get this as an over-the-counter medication. But you can always, get an elderly member of the family or someone that you trust to help you get this medication if it is needed. All right, I hope this video was very helpful in terms of helping you know if you would be needing a plan B or if you should not. So generally the rule of thumb is that the sperm can, stay within, the pubic region for about 3 to 4 days. And, you want to make sure that you are taking this plan B right before the sperm gets to your egg. So I hope this video was informative. Make sure you hit your like and subscribe button if you would like to get more video alert when we post them as well. Thank you and remain blessed.